Hello and welcome to our presentation. Greta and I had spinal muscular atrophy. So the diagnosis, spinal muscular atrophy, also abbreviated as SMA, which is what we're going to be referring to it as throughout the presentation. It's a genetic disorder characterized by degenerative weakness and atrophy of the muscles needed for movement. And the cause, all types are caused by mutation in the SMN1 gene. And the SMN2 gene is what determines which type and severity. And like I said, there's 4 types, and it's more severe in proximal muscles versus distal muscles. Usually worsens with age, and the effects of SMA often take a toll on the client's mental and emotional well-being, as well as their physical health. And then clinical management is a multidisciplinary approach in care, and it's mainly compensatory strategies and interventions.
So like Seth said, SMA is mutation in the SMN1 gene, and it affects the central and peripheral nervous system as well as skeletal muscles due to the loss of motor neurons that produce movement. This results in gross and fine motor deficits, more so gross motor than fine motor, but fine motor is still affected, and oftentimes lower limbs are affected more so than upper extremities. So some activity limitations that we found were mostly related to gross motor deficits due to the wasting and weakening of these skeletal muscles. And we also found that fine motor deficits were still affected due to the weakening of muscles that are needed for the fine motor movements, and coordination deficits were also mentioned. And so due to these motor deficits that the client is experiencing, they may have difficulty completing or the total inability to complete tasks such as bathing, walking, dressing, eating, transfers, mobility, housework, toileting, climbing stairs, grooming, crawling, or driving. So now we're going to talk a little bit about an OT's role in an elementary school-based setting. So some responsibilities of the therapist include administering different screening tools and providing support and education to other faculty members, and creating resources and different intervention strategies for the children, and providing referrals to special education services. A recent study done by Harrison Wilson found that teachers actually prefer collaborating with OTs because it creates new supports for the children with special needs, and also helps create new strategies that the teachers can implement in their classrooms with their students and their daily routines.
So how are we going to assess these kiddos with spinal muscular atrophy in the elementary school setting? So Greta and I found 2 assessment tools. One is the Pediatric Evaluation of Disability Inventory, otherwise known as the PEDI. And the PEDI really focuses on functional performance and the specific barriers or deficits that are holding the individual back. And it really gives us an overall general view of how well the student is performing with their functional skills. So specifically ADLs, behavior, cognition, communication, eating, functional mobility, and so on. And this assessment tool can be used in this setting because it assesses areas that are needed in school activities, such as playing on the playground with friends, ability to put on a jacket for recess, ability to eat lunch at the cafeteria, and ability to complete school assignments. And then the second assessment tool that we found is the School Function Assessment, or the SFA. And this just builds off of the PEDI, just in a more school environment. And it assesses participants in the classroom, recess, school transportation, bathroom, toileting, class transitions, meal and snack time, and so on. And it could be used in the setting because it measures all social and physical demands that occur while in a school setting, and is filled out by one or more of the school professionals based on their observations. And these professionals are fairly close to the individual, so they are well aware of how well the students are performing.
So for our intervention area, Seth and I mostly wanted to focus on functional mobility in clients with SMA. And so our main therapy goal that we created was that the client will maintain an 80% range of motion for 1 year through varying range of motion exercises. And our kind of reasoning behind this was because clients with spinal muscular atrophy are very difficult to increase their strength or range of motion due to the fact that their muscles are genetically wasting away. And so because of this, we want to focus on maintaining what strength and range of motion they currently have. And also range of motion is needed for most ADLs, including those that are performed within a school setting.
So how are we going to achieve that therapy goal? When Greta and I were looking for different treatment activities, we found it was somewhat difficult to find some because as this is a degenerative disease, we need to find compensatory treatment interventions. So we found a few articles. One of them was hydrotherapy. And so basically we immerse the child in 30 degrees of Celsius water 2 times a week, 30 minutes each. And this is going to help with range of motion alongside of the traditional range of motion exercises. And that's important because the authors of the article mentioned that measurable improvement in the quality of daily living may be obtained in patients with SMA subjected to conventional physiotherapy when associated with hydrotherapy. So you want to do those two in combination, and they're going to complement each other. The second article we found mentioned Therabite intraoral stretching advice. And this is going to be used every day for 10 minutes per day to increase temporomandibular range of motion. And they found that participants with SMA demonstrated 33% and 47% improvements in AROM and PROM. And participants or caregivers are reported improved feeding function, improved oral hygiene, or reduced fatigue. And then the last one that we did was knee range of motion exercises. And this is compensatory and component based. And so that's going to include wall slides and passive knee flexion and extension exercises and activities. And that's going to help with ADLs like walking, crouching, standing up, climbing stairs, putting on pants, and they require movable joint angles. And so by doing these exercises, we are increasing the range of motion, making these ADLs easier.
So now we're going to talk a little bit about how we would assess our progress and collect data. And so for the first intervention that we had mentioned, it was hydrotherapy. And so we would assess their progress by judging how much restriction there is while going through the motions during the actual hydrotherapy, as well as using goniometric measurements. For the second intervention, the Therabite, it has an oral goniometer that would allow you to track progress on the range of motion within a temporomandibular joint. And for our third intervention, the knee exercises, we plan on using manual muscle testing to measure improvements or deficits in strength and AROM and PROM for knee flexion and extension. So by utilizing these techniques, we are obtaining measurable and objective data to justify our continuation or cessation of the specified treatment and intervention options based on the progress or lack of progress that we see from the patient.
And so bringing it all together, Greta and I looked at our treatment plan and we found that we would utilize the biomechanical frame of reference because our treatment plan really focuses on functional ability as it relates to range of motion. And if you recall from our Cullen-Tufano book, the biomechanical frame of reference is often used when someone has a musculoskeletal disorder and is working on improving range of motion, strength, endurance, etc. And then we found an article also that identified the 4 main goals of this frame of reference, and they are to prevent limited range of motion, increase passive range of motion, increase strength, and to increase endurance. And so we looked at that and said that these main goals align perfectly with our treatment plan of combating the degenerative characteristics of SMA. And here are our references. Thank you for listening and watching. We look forward to looking and answering the questions that you guys have for us. And thank you.